My name is Chelsea Pascal. We are going to be doing an assessment on the abdomen, the gastrointestinal system, as well as asking questions about the genitourinary system of a female. So the first thing I'm going to do is inspect the abdomen. So what I'm looking for here is symmetry. I'm not noticing any masses or bulges of her belly. When I come down here to eye level, everything looks symmetric. I do not see any protuberance. I do not see any obesity. Everything looks very symmetrical, very flat. So the next thing I'm going to do is I'm going to take a listen to each quadrant, all 4 quadrants of her bowel sounds. If I do not hear bowel sounds, I would listen for 5 minutes at least before I said that bowel sounds were absent. So I'm going to start in the right lower quadrant. Move up to the upper quadrant. Left upper. And the left lower. I hear 5 to 30 bowel sounds within the minute of each one of these quadrants, so she does have active bowel sounds. The next thing I'm going to do is I'm going to percuss each one of these quadrants as well. So I'll do my 2 fingers. Okay, so the main noise that I hear is tympany, which is normal. That is because the air moves up to the top of the colon as it's coming through. So the next thing I'm going to do is I'm going to palpate each of these quadrants. So we're going to go here. Any tenderness or pain as I'm going across?
No.
Everything feels symmetric. This whole time I am also looking at her skin, making sure I do not see any lesions, and her skin is warm to the touch. Do not palpate any masses. So that was light palpation. The next thing I'm going to do is deep palpation. So in order to do that, I'm going to put my hand underneath this left side, all the way under here. I'm going to lift up slightly, and I'm going to palpate with my fingers facing up towards the axilla, and we're going to push hard and down. Any pain or tenderness as I do this? Nope. All right. So I do not feel her spleen, which is a normal finding. If her spleen was enlarged, I'd be able to palpate that. But so far on the left side, everything is good. I'm going to do the same thing on the right side. Hand underneath. And push hard and deep to feel for the liver. When I percussed her abdomen, I would listen for the dullness at the base of the liver and also the base of the spleen as I did earlier. As of right now, everything looks good. I have inspected, I have listened, auscultated, I have palpated, and I have percussed. So her abdomen looks great. Everything's intact. She has great bowel sounds. So we'll move on. She's going to sit up and answer some questions for me. In a normal office setting, I would do a full genitourinary inspection, but here we're just going to ask her a few questions. Do you have a normal bowel regimen
Yes.
that you do? Okay. Any bowel symptoms? Any bleeding when you go to the bathroom? No. Any diarrhea, constipation problems? No? Okay. Well, that's good. And then urinary. Do you have any frequency, any dysuria, any incontinence?
No.
No? Okay. And there's no pain, there's no blood, there's nothing. And you have a regular period?
Yes.
Awesome. And everything seems to be intact there. So that concludes this portion of the assessment.